businesses will not be affected by this order. I repeat, critical businesses will not be affected by this order. These include grocery stores, pharmacies, gas stations, banks, doctor's offices, convenience stores, medical supply stores, hardware stores, and automotive repair stores. Social distancing should be exercised at these facilities. Again, while they remain open, we ask that these businesses practice social distancing. The operations of our city government will also be curtailed, so we can focus our attention on what will be a growing burden shouldered by our police and fire rescue personnel. This is a time for shared sacrifice, as our nation faces one of the greatest crises, a virus that spreads with ease, for which there is no standard cure or treatment. I cannot overstate the threat of COVID-19 and the threat that it poses on our community. Developments today illustrate just how dangerous and deadly this virus can be. Because it is with a heavy heart that I must report that 3 elderly residents at assisted living facilities in our city have passed away. Test results have confirmed one was infected with the COVID virus, and we await the results of the other tests. The city is working closely with state and federal agencies to bring the necessary resources to bear and provide all the healthcare assistance possible. We are relying on the State Department of Health to conduct appropriate testing of other potentially impacted residents. Our concern goes further than the residents and staff of these facilities. On Friday, it was Fort Lauderdale Police and Fire Rescue personnel that assisted with the victims. Several are self-quarantined at this time. So I'd like to thank our residents and visitors for following the emergency rules up to this point. None of this is easy, but our actions are vital to addressing this global health crisis. Closing the public beaches was without precedent for the city, but necessary, and people have adjusted accordingly. I'd also like to thank our business community. COVID-19 has struck us at our busiest time of year and will hurt many of our small businesses. I am determined to work with officials at the federal, state, and regional level to find ways that we can assist and to support this recovery. In closing, I urge everyone to follow the prudent and reasoned guidelines being recommended by health professionals. If you feel sick, stay home. If your children are sick, keep them home. If someone in your household tests positive, keep the entire household home. If you are an older person, try to limit your trips outside the home and contact with other people. You are most at risk, and you cannot tell who may or may not be a carrier. People with compromised immune systems should follow the same advice. Even healthy people should take precautions. We are all at risk, everybody. Do your part not to become infected and become a carrier of the virus. Work from home if possible and avoid public gatherings of no more than 10 people. Keep travel and shopping to a minimum. And for everyone, please practice good hygiene. Together, we will overcome this challenge. Our community and our nation are strong and resilient. Let's all do our part in this effort to stamp out this virus in the coming days and weeks. Thank you, everybody.
Can you clarify the number of deaths and where it happens?
There are 3 confirmed deaths, 1 confirmed through the COVID-19, and the tests are still, we're still waiting results with regard to the other 2. And they were at nursing facilities with our city.
Same, all 3 in the same or
no,
separate?
Different ones.
Can you tell us the names of those?
It hasn't been confirmed with us what those names are.
Are they 3 separate facilities, or is it
2 separate facilities.
just 2 separate facilities?
That we are aware of. And this situation is changing every hour, so.
Mayor, it's suspected that these 3 deaths are possible. The one is confirmed, but the other 2 are suspected.
Yes, suspected, yes,
COVID-19?
exactly.
Do you know how they got the virus?
No, we don't. That's the scary
Do you
part.
know their medical history?
Each one had different medical history, and each one had showed different levels of symptoms.
The emergency responders, how many responded and how many are under self-quarantine?
I'm going to leave that question up to our city manager. Would you like to respond?
Yeah, so in an abundance of caution at this point, we've had all of those that could have come in contact, potentially in contact with the transports to self-quarantine. That's 5 firefighters and 1 police officer.
How does that impact emergency response and possible domino effect?
Sure. I mean, anytime we start to lose staff that has the potential for an effect on response, it would not have affected response at this point with those numbers. We've seen cities across the nation lose, in self-isolate or quarantine some of their public safety staff. That's why it's very important that we continue to encourage the use of proper protective equipment as these first responders interact with patients that might display the symptoms of COVID-19. But yeah, we will watch that in the coming days because we obviously have to continue to provide first response.
Have the 6 been tested?
I'm sorry.
Have the 6 been tested by firefighters and the police officer?
Certainly that'll be something that we work with the Department of Health on. I'm not at a spot that I really want to talk about medical information publicly with respect to their health, but we'll do the right thing.
Do you know how many deaths were at Atria, the one that's been widely reported?
So what's been reported to us is that there's 2 different facilities, and again, out of talking about health information, I'd rather that information come from the Department of Health, but I don't want you to think it was 3 or 4 or 1 or 2. I do believe it was 2 facilities, and as the mayor alluded to, we have 3 deaths, but at this point 1 that is linked to COVID-19.
Is the one that's linked to COVID the Atria, that confirmed link?
Yes.
But you can't tell us if there's a second death at that same facility, or if there's 2 deaths in the other facility?
I'd rather not right now. As soon as we know, we'll be happy to. This information, as you all know, once it's out, and I want to make sure that through all this, we have to make sure that factual information is out because we don't want the public wondering.
Is there any guidance? I haven't actually heard any municipality discuss yet daycares or child care centers. What's the guidance for them? Are they to remain open, shut down?
We have not given any instruction with regard to that. We asked that if they are going to stay open, that they practice social distancing and the hygiene practices that we've described again and again. But there's a whole list of businesses that we can go through, and it would be probably difficult for us to respond to every single situation. So we just described the main businesses, and I think that on a case-by-case basis, we'll have to address each one as they come before us.
Mayor, can you talk about the decision to close restaurants for 30 days? And you said that you're going to try to work with federal partners and try to support them. I mean, this is a tremendous impact.
There's a tremendous impact on everybody. And the business owners, the owners of the restaurants, many of whom came to us and applauded our initiative. And we've been speaking with our federal authorities. I just got off the phone with Congressman Ted Deutsch and discussed with him what programs the federal government now is going to enact to provide financial assistance for those people that are now unemployed. How are they going to implement and facilitate a fast-paced unemployment package for those folks who are now unemployed and get compensation. So like I said, we are working hand in hand with federal as well as state authorities to try to provide relief for those workers that are going to be put out of work for the next 30 days.
So to confirm, 5 o'clock, bars and dining in restaurants is done?
All in premises, on premises dining, we are asking that they close down by 5 p.m. today, and takeout and delivery services are going to be permitted.
And how are you going to enforce that?
We're going to do our best, and we're hoping that people cooperate because this is a community issue, and it's not for anyone to try to get out from under the rules. There's a reason why these rules are being put in place, and it's to protect themselves as well as everyone around them. So we're going to do our best. We have law enforcement, but this isn't about going down and beating everyone's head with trying to get them to comply. Come on. Everyone in this community is responsible for their own actions and how they're going to impact everybody else. So we're asking, a lot of personal compliance on everyone's part to make this work for everybody.
Are there any fines if anyone gets caught not following the rules?
Are there any fines? There are fines, and we have not yet established those. I don't think we've established fines or penalties yet.
Well, let me see if I can take a stab at that,
Yeah.
because we're not going to, this isn't about a fine event. This is about a public health event. And so, we're going to work with our restaurants. We've had great cooperation in the last couple days as we've implemented some of these regulations at the beach. If we get to talking about fines later, we'll worry about that. But look, this is about doing the right thing, and we're going to continue to work with the restaurants so that the impact is as little as possible, but that we can so we can get this done.
Sorry. Have gyms, bars, and these restaurants already been notified, or is this the first time they're hearing about this?
This would be the mayor's public declaration, and we'll go into a notice environment right afterwards.
I'm sorry, to go back about the nursing facilities, are they being aggressively cleaned where the one person tested positive or the
We
fourth
understand
person?
they are undergoing rapid sanitation right now. They realize that they have a crisis on their hands, and so it is our understanding that they are really in a proactive stage right now.
Are other people being monitored in those same facilities? You said
Everybody,
two, right?
everybody is being monitored and quarantined in that facility.
Is there one or two?
There are 2 facilities that we're aware of. Dan, do you want to comment on the business community and the impact this is having, and what you're hearing from the business community with regard to the measures that we are implementing this afternoon?
Sure. Dan Limblade, President and CEO of the Greater Fort Lauderdale Chamber of Commerce. Our business community applauds the mayor and his leadership, the decisions that he's making, the bold initiatives that he has declared today. All the restaurants are activating right now and trying to assess what they're going to do. Obviously, these are difficult decisions that have to be made, but we've already looked at other ways that they can redirect their services, whether it be through drive-through or through feeding, through United Way and things that we do with our not-for-profit communities out there. So we're looking at being creative and innovative in how we approach this to the best we can. As you all know, I asked Congress through the chamber at our roundtable with Congresswoman Wasserman Schultz and Congressman Deutsch a couple weeks ago for emergency appropriations. That's working its way through the U.S. Senate right now. The governor's already announced appropriations as well that will be available. We have SBA loans at no interest available to our companies. And when the mayor executes an emergency order, that automatically puts these businesses in a position where that they can access this funding, and they can also use their insurance policies that they have to also recover losses. So as it is a very difficult time for us as we try to contain this virus, we're doing everything we can, and we support the mayor and the commissioners and the city manager in all their efforts that they're taking today.
Thank you, Dan.
Can you guys talk about the response of these 2 ALFs? What health measures are in place? Are they going to be quarantined? We don't want a situation like we're seeing in Washington, I assume.
You want to respond to
Yeah,
that?
let me see if I can take that, because I don't know that we're necessarily the right group to be able to answer that specifically. You know, the Department of Health is the one leading there. They've been engaged and working with the ALFs. I can tell you there is not a mandatory forced quarantine at those locations, but that the patients that the people that have come in proximity to the patients that have been transported certainly watch for symptoms. But we're heavily relying on the state's Department of Health as the lead agency to work with the ALFs.
Why are you releasing the name of one of the facilities in question and not the other?
Because I just don't know it. And so I just don't have it to roll off my tongue.
Any other questions?
Are you able to confirm the COVID death as Richard Curry?
I cannot.
I don't have it.
Any other questions? You know, I know this is St. Patrick's Day, and this is not the best time to be closing bars. And, you know, but all humor aside, this is a very serious crisis within our community. And we're asking all the business establishments and its patrons to really try to work together to make a success of this. We need to not just flatten that curve that everyone talks about, but we need to eradicate the virus from Fort Lauderdale, Broward County, and the state of Florida as soon as the better. So, you know, let's all work together and let's see if we can make this happen. Thank you, everybody.
Thank you. Good job, man.
Good job, Jack.
All right, we'll see you guys. Stay healthy. Thanks, Stan. That's actually
Good job. It's too much.
Hey, what's up, Mike? How are you? Good. Good to see you. Good. Hey, Chris.